going to move your microphone so we can use the podium.
Is this good for me up here, not in your way?
Sure. My name is David Turner, Mayor of the City of Odessa. This is being sent Facebook Live, and of course the media is here. This is a press conference to address coronavirus. One of the things that we are concerned about as leaders is we continue to work on suppressing this illness. Currently in the United States, there's 46,805 cases for 593 deaths. In the state of Texas, there's 410 cases and 9 deaths. I know that death number is a little low because of a couple of people that have passed away in the last 24 hours. I want to talk as a parent right now. A friend of my family had coronavirus. He had pre-existing conditions, and he died last night. And as a parent, one of the most heart-wrenching things that you can have to deal with is dealing with one of your kids as they are grieving. This man was an amazing pilot, and he taught my son to be a better man and a better pilot. And his family lost him last night. Why do I tell this story? Because to the citizens of Odessa and Ector County, this is serious. I know you look around and you get scared because of everything you hear on the national media. The death rate is very low on this, 2% to 2.5% tops. But we have to stop the spread. Things that we have been preaching, and we are going to continue to say. 1, social distance. Do not get within 6 feet of anybody. If you do, you become into that zone where you can catch the coronavirus. Another is wash your hands. If you touch your face, if you touch a handrail somewhere, if you touch the cart in the grocery store and you didn't clean it with one of their sanitizing cloths, you need to wash your hands. If you touch anything, do not touch your face, your mouth, your nose, your eyes, because the virus can get in that way. If you are sick, or you have a family member that is sick, what you need to do is quarantine the entire family. I know as a father, when your kids get sick, you always ask them, well, do you want popsicles? Do you want ice cream? We can't do that this time, because if you leave that house, you can be a carrier for the coronavirus. You need to stay home, wait 14 days until everyone's healthy, and then go out. Your community leaders are working diligently behind the scenes to make sure we have enough supplies and that we are ready to go. You are going to see some things such as City Hall is closed to visitors. Why is that? We have to supply critical infrastructure, which means sewer and water. I just want to conclude by saying thank you for what you're doing, and continue to be vigilant in the fact that you're washing your hands with social distancing, and most importantly, if you get sick, stay home. Now Brandy with the health department will come up.
Good afternoon. I'm Brandy with the Ector County Health Department. So we are continuing to work closely with the hospitals, with the state. Also, we also want to emphasize on staying at home if you're sick. We want everyone to remember the social distancing, and those procedures are in place for a reason. So we want to emphasize to everyone that it's very important at this time that our community follows those rules and helps protect everyone. I also know that we've got several questions wanting to know how many people are being tested. So as of yesterday afternoon, we currently had 35 people that the health department is aware of that has been tested in Ector County. We have 14 tests that have came back negative, and we have 21 pending cases. that we're waiting results for. Now, I do want to stress that these numbers that we have may vary because there are private labs. And if physicians in the private labs are doing testing, they are to report the results to us only. So we may not exactly know what is pending at this time. So those numbers can be above, they can be different depending on how many providers are doing private testing. So that's the information that I had for y'all today. I'm going to turn it over to Dr. Saravan with the ORMC.
Hello, I'm Dr. Saravan, Chief Medical Officer for Odessa Regional Medical Center and for Scenic Mountain Medical Center. I want to start by saying I want to extend my sincere gratitude and support to all the healthcare workers in the Permian Basin and around the world that are helping us fight this disease. Hospitals and health departments have been working together very closely to try to prepare and try to contain this disease as best as we can. You heard from our mayor how important it is for us to stay home. Don't go out anymore except for groceries or medication. This isn't the life any of us expected, and certainly there are others who will make much greater sacrifices than this. It will last longer than any of us want it to, but it'll still be just a piece of our whole lives. Why ask so much of people for just a few hundred cases? That might be the question that you're asking, because it's the only way we can save lives, and now is the time to do it. The numbers that you heard about today from the health department are the people who got sick a week ago. And there are many more people who got sick today who don't even know they are sick yet. They picked up the virus, and it'll take a week for them to show up in our numbers. Waiting for hospitals to be overwhelmed will leave the following week's patients with nowhere else to go. In short, without taking these drastic measures, the healthy and the optimistic among us are putting others at risk. We need to fight this fire before it grows too high. But these extreme restrictions may seem in the end a little anticlimactic, because it's really hard to feel like you're saving the world when you're sitting on your couch watching Netflix. But if we do this right, nothing happens. Yes, a successful shelter in your house means that you'll feel like all this was for nothing. And you would be right, because nothing means that nothing happened to your family. And that's exactly what we're going for here. Together, we'll find a way back to the life that we were used to. Public health and hospitals have been. This is a huge sacrifice to make, but a sacrifice that can make thousands of differences, and maybe even a difference in your family too. As a hospital, ORMC is very prepared. We have units ready. We have doubled our capacity to be able to take care of patients on the floor. We've doubled our capacity to be able to take care of patients in the ICU. We have an outpatient testing center now that only requires a doctor's order for you to get tested. More of that information is on our website. So we are doing the best we can, and we are ready, but we do need you to do your part as well. Thank you so much.
Good afternoon. My name is Russell Tippin. I am the President and CEO of Medical Center, and I have with me Kristen. Y'all all know her. She's our Chief Nursing Officer. And we want to thank you for your time today. We have some things we'd like to discuss just about Medical Center and what we have going on and some changes we have coming up. And just to give out some good information, but would like to echo what you've heard so far, that the stay-at-home approach is the best approach. The wash your hands is the best approach. We're all going through this together. This is something that we have never most of us experienced in our lifetime. Hopefully we won't experience that again, but to work together as a community, as all the entities together, I think that is very important. And of course, I wouldn't be doing my part if I didn't get up here and encourage you to pray for your neighbors, to pray for your police, your fire, your doctors, your nurses, your housekeepers, that you just find time to be with your family and to offer up those prayers, because we all have to take care of each other. And I think that that starts with prayer in our homes and our jobs, and that we just remember who controls the future. I want to talk a little bit about Medical Center, our surge preparedness. We have geared up and we're ready for the initial wave, the initial surge of folks searching for help and for testing. We have built some very strong regional relationships. We've been in contact with our friends in Rankin and Crane and over in Pecos and Fort Stockton. We have those relationships in place where we can work with those groups and those hospitals to provide health care in tandem with those folks in our region. Our staff is ready, just like the ORMC staff. I'm sure they're geared up, they're ready. We have measures in place. When these people come in, our staff is trained, our masks are ready, our gowns are ready, and that staff, they are primed and ready to take care of you, your family, and your neighbors. We have a few visitation changes I'd like to cover quickly. Medical Center is going to restrict entrance down to 3. We're going to use 3 entrances only, and let me give you those. That's going to be our emergency department, our Center for Women and Infants, and the main registration area. We feel like we need to tighten that down a little bit just to control the traffic in there. ED is going to be for ER patients only. Of course, the CWI, or that's the women and infants, is for OB patients only, and the main registration is all for the other patients. But if you'll please work with us in that, be patient, we'll get you directed in the same spot where you need to go, and we'll get you taken care of. Our screening is also going to start including temperature checks at these points when you come in. We got our thermometers ready to go, the laser thermometers, so you will see that as you come in, so be prepared for that. One of the biggest changes we have is visitors into our hospital. Right now, we still have some, are allowing visitors on a limited basis. We're going to clamp that down as well to protect these individuals in our hospital. So we have specific groups only that are going to receive what we are calling a wristband that we're going to give you to wear, and that is only for a certain group of people, and that is going to be patients like pediatric patients, OB patients for delivery, to have a +1 there, our non-communication patients, and our end-of-life patient families. We're going to have only 1 visitor with a wristband from now on. So you'll see those when you come in. When they register, we'll be able to get that person's name, get their wristband put on them. But we have got to tighten that down just to protect those in our care and just to make sure that we're providing the best, safest environment to our patients with this wristband setup. I want to encourage the use of phones and video chat, FaceTime, Zoom, all those media platforms out there where you can have these conversations with your loved ones or your doctors via these media platforms. We want to encourage that. We're working on that for doctor visits and all sorts of patient communication, so be on the lookout for that. But we want to encourage that as you stay at home and you protect yourself. I want to turn it over to Kristen to say a few things, and then I'll wrap it up after that. Kristen.
Thank you. Good afternoon. I just wanted to go over a couple of access point issues. I know a lot of testing and screening questions have come up. Currently, we have opened up our urgent care facilities. So we have 5 of those, and we have that 1 testing site. So all of the screening and things that you're seeing going on, now you have more places to go in order for that to happen, so that you're not, if you're not able to get into your primary care physician's office, you have other points of entry. And we'll be honoring those co-pays as well as a service to you as the community goes. Along with our urgent care screenings, we've opened up a call number. That is 432-640-2747. And that number is for anyone that has a question so that you don't have to get out and go to the doctor. Just give us a phone call. We have nurses manning that, and then we can answer any questions, see if you qualify to have further screening and possibly testing so that we get you to the right place and you're not just wandering around the community trying to find a resource. We also have those different screenings in place for you. We're following the CDC guidelines. We're going to ask you about travel, known exposure, possible exposure, any of those symptoms that you've been having. Our physicians are being very diligent in who they test, when they test them, and how quickly we get those tests back. If there was any questions about the resources and how quickly you can get screened or where to get screened, I would encourage you to look on the Medical Center social media as well as our webpage. We have all of those links in the direction to you so that you know before you leave your home with your loved ones or yourself where to go and who to contact.
Finally, just to wrap things up, I wouldn't be giving thanks where thanks is due if I did not send a very large thank you out to the ladies and gentlemen who have contacted us about making these masks, our surgical mask. That has been a true blessing for us, for our providers at Medical Center, really for all over the nation. This thing has taken off. But the church groups, the Dr. Armstrong and her group, the Facebook groups, everybody that has reached out to us willing to make these masks. Some people are being very creative with these, and we appreciate that because we're going to need them. So if you're thinking about making them, we need them. If you want to find out how to make those, look on our social media. We've got it posted. There's groups all over social media telling you what the pattern is, how to make those. Thank you, thank you, thank you very much to all those ladies and gentlemen that are working on that at night at home for making those and providing that safety for our healthcare providers. We thank you for that. That's what America, the United States, is set on. That's what Texas is about, is that we take care of each other. And these people sewing these masks at night and at home, we really appreciate that. So thank you very much.
Good afternoon, everyone. I'm Scott Murray. I'm the superintendent of Ector County ISD, and it's a privilege and an honor to be here today and to collaborate with these other community leaders. And I will echo the same message that you have heard throughout the afternoon. And in response to a governor's order issued a few days ago that schools in the state of Texas remain closed through April 3rd, and we're doing that in response to the social distancing opportunity. We also want all of our students and children and staff members to remain at home. That is the wise thing to do right now. But a part of those governor's orders were that school continue in a very different way. And I want to lift up today our teachers and principals and central office folks that have worked diligently to create school in a period of 7 days in a very different way. We've spent centuries doing school in a very traditional way in which a teacher was with a group of students. Well, today, in 7 days, we've had to redesign that model. It looks very different. Schools are closed through April 3rd, but I want our community to know that that date is probably going to be extended. And all of us, whether students or parents or educators, need to embrace that opportunity to continue to do the good work that's happening. Yesterday in ECISD on Monday, we launched remote school. And it looks very different in different families. We know lots of moms and dads started yesterday morning picking up a packet of information and ensuring that their kids were following a schedule throughout the day, and we certainly appreciate that. While other families in our community may have had two working parents, and so they left their homes yesterday morning and their kids may have gotten online and did some engaging activities. And again, we appreciate parents for creating those schedules. This is new for all of us, and so I want to encourage our parents and guardians I want to take away a little bit of your stress. It reminds me of our brand new teacher on the first day of school. Life is really difficult for that teacher on the first day of school, and they've been educated to become a teacher. And so we know that as moms and dads and guardians, that the first day of school for you yesterday was probably very stressful. Our commitment to you is to continue to work over the coming days and weeks to ensure that this remote school experience is the very best experience that it could possibly be. At the end of the day, we are committed to providing a rigorous instructional program for our students, and you can expect improvements every single day. We appreciate the great feedback that we've received already, and we ask that all of you continue to give us feedback as we continue to modify that school model. A couple of other quick updates. Yesterday, we fed over 16,000 individuals in our community, so clearly the need for our students to receive food is significant. And I can assure you that we will continue to provide that service until it is no longer needed in our community. We offer meals 5 days a week, Monday through Friday. We start breakfast it lasts from 7:30 to 9 o'clock, and lunch begins at 11:30 and goes until 1. It is a curbside service, so you simply drive up, pick up the meals for the number of students or children that you have, and then you may leave the school at that point. On Friday afternoons, we offer a treat. When you stop by on Friday afternoon, you also get meals, breakfast and lunch for Saturday and Sunday. So you get 5 meals for the price of 1, and that price is free. So we appreciate the federal government for giving us that opportunity to provide those meals for kids. But that service will continue until further notice. And the last thing that I want to announce today, starting Wednesday, tomorrow morning, from 7 a.m. to 9 p.m., we will provide counseling services for all of our families that may need to be in contact with a counselor. The current environment today has certainly created a lot of stress in our community, and we want to be responsive to the needs of our students and responsive to the needs of our family. You'll find information about that on our website, but again, starting tomorrow morning from 7 a.m. to 9 p.m. every single day, we will provide opportunities for our students and families to have access to the counselors in ECISD. And lastly, I would encourage our community to continue to follow the guidance that we receive from our medical community today. Continue to practice those social distancing skills, continue to wash your hands frequently, and continue to reach out to those, your loved ones, your family, and your friends, using the tools of technology to maintain those healthy connections. And together, as a community, we will continue to stay healthy and thrive through this opportunity. Thank you very much.
I'm Sandy Woodley, President of University of Texas Permian Basin. I really echo the sentiments of our community leaders here. You know, we really are working hard in this community in Midland and Odessa and the Permian Basin to do the right thing, and I'm encouraged by that because I know that the short-term sacrifices that we are all making will make a difference. These sacrifices to stay home and to do all of the things that the CDC requests and that the governor requests and that the judge requests as we go forward, they will save lives in the long run. The important thing is for us not to overwhelm the health facilities all at the same time. So flattening the curve is something that we're all committed to in our own way. The University of Texas Permian Basin, we're going to do our part. What I want to say is our university is now closed to the public. It's closed to the public until further notice. Only UTPB faculty, staff, and students will be allowed on campus, and even then it will be very few of us that will be on the campus at any given time. We will not be closed for business, however. We are continuing our essential services. Everything is full speed ahead, thanks to a lot of quick learning of all of us on technology. Our faculty, I'm so proud of them. Some of our faculty with a flip phone today are delivering online courses to our students. I'm really proud of that. Everyone is pulling together in the way that the Permian Basin does. We will adhere to CDC social distancing guidelines. Even though our campus is closed, our walking trail is not closed. The public, you are welcome to come and walk on our trail. Again, 6 feet apart. Try to practice that social distancing. We are extending our services to our students and to our faculty, so we will be using technology to have even more expanded services so that our students can all be successful and they can make their way to the end of the semester. Our physical offices will be closed for now, but our virtual offices are really ramping up. We're sending students, faculty, and staff to work from home. Almost all of our A Falcon family will be working remotely most of the time, starting now. We will make sure that all of the services do go forward. We also have had to sadly send most of our students to their homes, and that has been very difficult for our students. The only students who will be allowed to stay on the campus per University of Texas guidelines, and I agree with those, are those who literally have no other place to go. So we have international students, for example, who can't make it home at this time. We have students who may not have a home to go back to for various reasons, or they may not have a safe home to go back to, and all of those students will be allowed to stay, but it will be a very small number of students who are on the campus. We're supporting them to get back to their support system until this crisis is passed. We want you to know that, you know, summer and fall are going to go forward. For those seniors out there in high school who are worried about not being able to take SAT tests or challenges with getting official transcripts, we are going to make accommodations to make sure that you have no barrier in your pathway to continuing your academic progress. That is our job, and we're committed to it. We're really proud of the Falcon family and how everyone has come together, and I personally am really proud of the Permian Basin and the family that's here. We're all pulling together. Stay with it. Keep at it. It will make a difference.
Good afternoon, everyone. Thank you all for being here. We are in this together, and I want to begin with the end in mind, actually, as the mayor has advised me to be brief. So, Mr. Mayor, I will honor that, and I will begin by thanking you all for what you're doing for us. Again, we're in this together. I'd like to thank all of those community leaders, our national leaders, statewide leaders. People are doing the best they can to help us to be the best we can as we fight our way through this struggle, through this crisis. In addition to that, I would be remiss if I didn't thank our medical professionals and all of those frontline people who are fighting the good fight. Thank you for what you do. We at Odessa College, we're in the business of preparing those people to do that work, many of them. And you need to know that your community college, Odessa College, will continue serving students. We pay all due respect to the governor's calls. We're following all the protocols, the CDC. We are doing everything in conjunction with that guidance, but we will continue to serve our students until the very end, whenever that comes, many, 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 many years from now for all of us, I hope. But we're going to be in this fight helping, filling in the breach, whatever we need, students who need support, students who need food, students who need whatever, community members who need our support, we're here for you. Our priority is to continue to provide a high-quality education. That is needed not only today, but the future of this community needs all of we educational entities to provide a quality education, and we will do our part. We've moved all of our courses online with small exceptions for those lab courses where students actually need to do some physical work. But we're doing that in small groups and under the CDC guidelines and guidance. We will continue to offer services to our students. We know that they need support. We know that they need counseling from time to time. We know that our students need advising. We know that our students need tutoring. So any student taking a class at Odessa College or thinking about a class at Odessa College, please know that we get it. We're adapting to this new world, and we will continue to make support available for you. Also know that Odessa College is operating under altered operations, which means that most of our employees, the vast number of our employees, are working remotely, but they are working. And we're only have essential staff on campus at this time, but all of our people are pulling the rope, and that rope is in support of this community and in support of everything that we're trying to accomplish. So again, my main message is Odessa College is here for you, and we're going to stay in this fight with you, our community. And again, we thank everyone for their work. And now I'd like to invite Judge Debbie Hayes.
That's a lot of information, isn't it? It's a lot of information to all of the homes that are listening. But we deeply appreciate you taking the time today to listen to our message, because our message that we are delivering is extremely important to every single one of you that is listening. You are surrounded with people that care so much about you. Your leaders, your elected officials. We want to go back to normal. And we will. We will get back to normal one day. But right now, we cannot stress enough to you to continue to practice all of the CDC and what the governor has restricted us to doing as 10, no more than 10 together, 6 feet apart, and all of the bullet points that have already been mentioned. So with that being said, one thing that I do want to address with you guys today is there is a emergency management plan that is written and has already taken place, so that when this emergency is full-blown in Ector County, there are already leaders partnered with the county and the city, with your education departments, with your hospitals, with your grocery stores, with the food bank, with a number of other entities that are working hand in hand to make sure that we get through this crisis together, because we can, without a doubt. This morning, because that I wanted to actually make sure that we had food for you, I was at HEB at 6 o'clock this morning, because I wanted to witness for myself that there was actually produce there, that there was meat, that there was milk, that there were water for your baby's formula, that there was distilled water for medical needs in your homes. And it was there. It was actually all there. I was amazed at what a wonderful job that your grocery stores are doing for your community. They are working 24/7. But what I would ask you to do for me and for the neighbor down the street that could be a single mom, or my mom, who's 84 years old, who lives on Social Security, that only gets that one paycheck once a month. When you go to the store, think about what your needs are, and only purchase what your needs are. Because there's that mom that's a single mom that has 2 kids, or my 84-year-old mom who wants to go to the store and hasn't been to the store yet, that needs to purchase her needs. You are doing an absolutely amazing job as a community. I need you to keep doing what you're doing. You're practicing what you've been asked to do. And if you continue to do this on this path, then we will conquer this virus. So I ask you to stay at home as much as possible. Only go out when you're needed. And if there's something that you don't know the answer to, please go to the websites, to your hospital, to your health department, to the county, and to the city. And we will get those answers posted as fast as we can to whatever your needs are, or call them, and we will put together those answers on our websites. We want you to be informed. We want you to have the answers, and we're here to support you. And what I would really like to do, our dear Heavenly Father, this is a time that we bow to you. We know that you know what struggles that we are all facing across our community, our surrounding communities, our nation, and our world as a whole. But we know, Father, that there's a light at the end of this tunnel. And we can see that light because we know that you are there. Father, I just ask that you be with every single person that is treating those that are sick. And Father, I just ask that you put a hedge of protection around each and every one of them because we need them. That you would protect our law enforcement and our first responders. And Father, I just ask that the leaders that stand with me, shoulder to shoulder, you would keep them healthy because we need each other. And Father, for the family that's sitting in their home today, I just ask that you blanket them with a comfort of peace right now. And we ask all these things in Jesus' name. Amen.
We're going to bring everybody up individually, so if you have questions for them, they'll be here in just a moment. So are there any questions for myself? Yes, sir.
Mayor Turner, the individual you referred to that passed away, is that the patient at Midland Memorial who was just announced?
I don't want to say too much more with HEPA and everything, but it was a loss for our family, especially their family. Anything else? Okay. Let me bring Brandy.
Yes.
Midland has reported, I guess, 149 tests. As of Saturday, we got, I guess, I said 15 tests. You said 35 as of today. I was just wondering, isn't that a little reckless not to be testing more if we have the resources to do so?
Again, the private testing can be done through providers. Some of the providers are doing those private testing. The health department may not have all those numbers. We know that we have the numbers for public testing. We are getting some of the numbers for the private testing, and we are working with the providers to ensure that they are aware to give us those results when they come in. But there is other tests that are done by private tests that may not reflect those numbers. Yes?
Well, why is Midland able to do so many more tests than Ector County and Ector County hospitals?
Well, I can't answer for Midland. I know that Ector County is, and the hospitals are, they are testing. Both hospitals are testing. They're doing private and public testing. So the numbers have rose since we have started trying to get those numbers from the private providers. So I can't answer for why Midland isn't.
Well, are there any programs in place to boost those numbers?
The medical center is doing the urgent cares, and they also have the screening for you to call. And so those are things that are going into effect to help with people finding where they can go get tested. Yes.
And can you tell us a little bit more about who is able to get these tests and kind of what the process is to get to that point?
Those that go through the public labs, they have to meet certain criteria. So when they go for private, they would go to their physician, and the physician would then make a determination if they are eligible to get testing through the private lab.
Can you explain any more of exactly what kind of criteria they need to meet in order to get the test in Ector County?
They ask about the travel history. They also, we suggest that they do a respiratory panel, and there's other questions that they ask.
Could you tell us about the state of the hospital as a whole as far as keeping on schedule and
That would probably be a question that the hospital can best answer. There are no confirmed cases in Ector County, no. That I don't know.
How many PUIs has the Ector Health Department recorded so far?
The PUIs are the number, the 35. That's what the PUI is. That's when we send off for the testing or we know of testing their PUIs.
So anyone who gets a test is a person under investigation?
If those tests are sent off for the labs, then that's what we put them under. Mm-hmm.
What did y'all say, like y'all were expecting those results to come back?
If they go to the public labs, it's usually 24 to 48 hours. The private labs, we've heard they can go from 3 to 5 days or so.
Can you go over the health department then? If you keep on schedule or how the staff is doing everything?
Right now, we are closed to the public. We're utilizing all of our staff to train, to do calls. They're answering calls. They're helping people who are wanting to get tested where they need to go and where to reach out. We also get calls from physicians and other things that the staff is working on. And so we're utilizing all of our staff right now for the COVID.
Do you believe there's community spread in Ector County at this point?
I think that it would be wouldn't be very smart to say that we definitely don't have it here. We have seen that it has spread all over. And there are people who have been in different locations, so the possibility, yes, is high. But again, that's why we put the precautions in place that you need to stay at home, enjoy this time with your kids, enjoy this time with your family, and if we do those things, then we can significantly reduce the probability of spread.
It's been a little difficult to get information from the health department. I was wondering, if isn't it time for the medical center to run this? They have staff, have expertise,
Well, the health department is limited on what staff we have because we are all trying to work on this particular incident. And we want to make sure that in the event that we do need to utilize everybody that we have, we are. So that would be something that we would look at probably in the future to see what could be done.
Can I just address the criteria question right before, because that maybe was not fully clear. So health department has certain criteria, and then us as a hospital, we have some separate criteria. Medical center might have some separate criteria as well. The health department's criteria is symptomatic patients, symptoms defined as fever, cough, shortness of breath, plus an exposure. So exposure meaning travel to a level 3 CDC country, which you can find online, or travel to a known level 2 hot zone. So for example, Seattle, hot zone within the US. So that's the criteria, is symptom plus exposure. Not exposure to someone who's sick, exposure to someone who is confirmed COVID positive. The third criteria that the health department has is someone with severe enough symptoms to require hospitalization without exposure. So the question about PUIs, persons under investigation, it's because those people that are in our hospital, they might not have had any exposure, but they're admitted with symptoms that could be COVID. It could be many other things too, but it could be COVID, and they're admitted. So they qualify as a person under investigation. So person under investigations are tested people that are waiting for results. After that, if they come back negative, they're no longer persons under investigation, they're negative. They are whatever it is that they have. And if it's positive, then it's a COVID positive patient. So I hope that helps define that. ORMC, as I told you, does have an outpatient testing center. We're open 9 a.m. to 1 p.m. 4 hours a day, 5 days a week, Monday through Friday. That started yesterday. I told you it only requires a doctor's order. The doctors are given criteria in order to place that order. Our criteria is slightly looser than that of the health department. We're sending our stuff to LabCorp. All the tests that we have sent so far, I think as of noon today, we had sent 11 tests. We've gotten none of them back yet. They are taking days to come back because the lab's probably overwhelmed with the number of specimens they are getting. We haven't sent anything to the health department lab. We've only sent it to LabCorp. But every test we are sending, we are notifying health department that we're sending those. So they have an accurate number of what's at ORMC right now. Our criteria, I guess I should talk about that. Our criteria, a little bit expanded, was the first 3 that you already heard about. But in addition, it will be if there are people exposed to congregations of people that were very large, that many people got sick with the same symptoms. That would be one thing that's allowed to be tested by doctors to write that order. And the last one would be if you have high-risk comorbid conditions, like if you're immunosuppressed, if you have diabetes, if you have COPD, if you have any other comorbid condition that your doctor believes makes you high risk and you're symptomatic. So if I have to give you there's a lot of criteria I just gave you. So if I have to give you overarching criteria, symptomatic plus comorbidities, or symptomatic plus exposure, or symptomatic plus hospitalization, that's one. Asymptomatic people are not being tested. Doesn't matter if you think you were exposed or not. Asymptomatic people are not being tested. At least that's what we're telling the doctors. But we're not policing what the doctor's order is. If the doctor writes an order for a test, we'll draw it or we'll collect it at our outpatient lab. Other question?
Are there any plans at this time? I know you are opening your clinic, but about between either hospitals for a drive-through testing station?
So our testing site, I think MCH told you exactly how many entrances we have open. We've also closed down most of the hospital. There's only 2 entrances to the hospital. But our outpatient testing site is in our community health center. Remember, don't show up if you don't have a doctor's order, and that's one of the big things. So it's at our community health center, and that's where you would come with the doctor's order to get the test. It is not drive-through, but it's in and out without exposure to the rest of the hospital. That's the point of drive-through, is you want to keep it away from the rest. So this part is sealed off from the rest of the hospital. It'll be in and out just for the test.
And with the first step being just announced, does that change anything with how ORMC or MCH is approaching the COVID problem?
So I think you guys asked about whether or not we think it's community spread, right? By definition, community spread means that you have a positive COVID case that does not know how they got it. So there's no confirmed exposure, but they are positive for COVID. So Ector County currently doesn't have a positive case. So we can't, so by definition, we don't have community spread. But it would be foolish to say that it's not here, right? The other question was about why did we do so few tests? Such few tests were available. Tests are basically swabs that go in collection kits. And that medium that you have to put the swab in is very limited in supply, and that's what limited us from getting the number of tests out. We have loosened, not we, labs have been able to prove that they can do the tests with less medium, so that gave us more tests, and labs have been able to do the tests if you send it in saline, just normal saline. So that's improved the number of tests. So now we are only limited by the number of swabs that we have. We have 500 plus swabs in the hospital, but those swabs are used for many other tests. They're not used just for COVID. So we'll do those tests. That's why we opened the outpatient testing center. So we'll do those tests when we have a doctor's order if it's appropriate. And that's about it.
Are you indicating that Ector County had less test kits than Dillon County?
No, that is not what I'm indicating. I'm just telling you what we had so far. But the regulations as they rolled out and the expansion from the labs happened over the last 48, 72 hours. So Midland maybe has sent much more tests. Actually, I know they have sent much more tests in the last few days than prior. But before that, we were following only the health department's criteria. Only after the lab expanded, we started following more. There was a question back there.
How are y'all keeping on supplies? You mentioned that you have your swabs, but they're used for other things. What about masks and the personal?
Yeah, that's a great question, and we're answering that question both internally and externally. Currently, ORMC has a healthy supply. You define that the way you want. We have a healthy supply to take care of what I told you before was our capacity. But that can run out very quickly when we hit capacity. So like Medical Center was saying, we're also open to community donations. Call us. There's a media release out there with an email address that you can email so that we can get some supplies from you. But for now, we have the things we need to take care of people. Yes, one more.
You mentioned that the swabs were one of the main things that hold you back from doing more tests. Is that something that people can donate or that you're looking for donations of?
No, those are specifically given to us by the lab companies. So I'll let Medical Center take some more questions as well.
On the drive-through testing part, our strategy has been that the way we have it set up now, we feel like that we're able to reach a pretty sufficient number of folks. One thing I want to be careful of when you say drive-through is, the drive-through is a screening process that then gets you down to who needs to be tested. So we feel with our urgent care clinics opening up and what we have going that we're in pretty good shape right now with that. So that's our strategy today. Yes, sir.
Do you think it's time to put someone else in charge of informing public on what is actually going on?
Well, I can tell you that even with our employees at Medical Center, we have discussions all the time about staying in your lane. And right now what we're trying to project and to give to our community is cooperation with our other entities. And I know that the share of information, especially in today's world, I can text something right now and it be spread all over. That's the, a good way to get communication out there. But I think our job right now and what we're trying to do at Medical Center is to stay in our lane and do what we think is best for our patients. Did I dance around that enough for you? Does that sound good? Thank you.
In answer to your question on supplies for Medical Center, we are also in a healthy position as well. But that is why we ask the communities to help us in limiting our visitation, because if you have a temperature, then we have to give you a mask. And so we're really trying to give those to our staff that are working, and to our providers and to our patients. And so the ability to limit our visitation is really helping us with our supply, but we also are continuing to receive our shipments, and we have a healthy supply so that we have that for our staff.
You'd be surprised how many masks it takes to take care of one patient. How fast you can go through those. So.
Are y'all looking at possibly rationing masks at some point or reusing them? And H said that they've been reusing N95 masks. They're doing different things to use them.
So we have multiple teams that are working through that process, including our clinical providers and our staff that are involved in those discussions. We are setting up a process so that you can reuse your mask after a certain period of time unless it is soiled. We're providing them the means in order to store their masks so that they can wear that again later in the afternoon if need be. We're doing the same thing for gowns. So all of those things, we're walking through the guidelines of CDC along with our providers to ensure that everyone has the right equipment at the right time.
On the physician side, how are y'all with the infectious doctors, physicians? Are you set up for that type of critical care with the physician side?
Yeah, I think that both facilities, and I'll let you speak, we're in great shape with that, and those guys are really tuned in. They're probably the most prepared guys in the whole system because they're dealing with this on a day in and day out basis. Really proud of them. I mean, they're really specialized into this type of scenario. They're doing a lot of research. They're germaphobes. I mean, they're into this type of stuff. So we are really appreciative of the work that they have going, and that's just not here, but that's nationwide.
Yes. So if I could just add to that, I would add that the CDC has specific guidelines on how to recycle PPE, how to prepare your floors for arrival of COVID patients, how to protect yourself when you're taking care of a COVID patient. So we are following all of those. The nice thing for us in West Texas, if I can even call it that, is we have this time to actually prepare where we know we don't think it has hit us yet, and that's a very big difference between some of the bigger cities where it hits so fast before they have the time to prepare. So we are thankful for that time.
Anything else? Yes, sir.
Speaking of preparation, are either hospitals currently working on a plan if y'all do get overwhelmed and have to choose who gets a respirator and who doesn't?
We're going to talk
So
about that.
that's a tough question. It's not just a medical question. It's a very ethical question. We are not at that point now, but I can quote you a Harvard study that just came out about a number of possible need for a community our size with the travel that we know of, and if it does hit us, where will a best case scenario be and where will worst case scenario be. The Harvard study defined worst case scenario as 60% of our population getting affected within a 6-month period of time, which is the curve that goes straight up and down. The best case scenario, the flattening of the curve, that was defined as 20% of the population getting affected over an 18-month period of time. The area under the curve, number of people getting affected, is still the same, but flattening the curve over time will allow us to not have to ration, not have to choose, but to take care of everybody because we have that capacity. But if that peak does hit, we are preparing for that peak. So at that peak, the Harvard study is showing us, and thank you UTPB for doing analysis on that Harvard study. That number is 200% need for floor beds and about 400% need, 4 times the need for ICU beds. So ORMC right now already has capacity for 200% for floor needs and at least 200% for ICU needs. One of the nice things that's floating around the medical community now is that we can share ventilators between patients. And there's many criteria to do that, but there is a way to do that. So if you double the number of ventilators, then we are 400% at that prepared limit. So I think we'll be okay even if we hit that curve. And that's the preparation that we are doing as a hospital.
Yeah, we've seen that where those ventilators are split off too. I've seen them up to 9 times. They've had them split up, just depending on the capacity of the ventilator. Did you want to say something about that?
I was just going to say we're doing the same. Instead of having those conversations currently, we're having the conversations of what do we do and what equipment can we use before we even have to get there. Because our goal as healthcare providers is to provide you care. It's not to determine whether you get it and you don't. So we're really stepping up and having those conversations about the equipment. And we are the 200 and 400 plus prepared as well because we have bought those over a period of time, and so we're making sure that we have the proper equipment all set up and ready for when those patients do come.
I guess my follow-up question is, you know, triage is an important component of medical care. I guess when is the right time to start having those hard ethical questions for when you do start, like just in case for the worst case scenario, when you start making those plans?
Well,
I think you make them now.
Yeah,
like
the
we have
plans
to
are
start
already
having the
being made.
plans now.
Exactly, exactly. The plans are already being made, but we won't make those calls until the situation arises.
Of course.
Are y'all looking at any spaces that might work for overflow outside of your hospitals or if that time arrives?
We do, as Mr. Tippin alluded to previously, we have actually been reaching out to our regional partners to say if we get to a point where we have to take a lower acuity patient that is almost ready for discharge but not quite yet, could you take them? And they're willing to take those patients on so that our hospital, having its capacity to take a more critical population, could do that. So we're working through those as well. So our walls expand way more than just what's on our campus at this point.
So I'll echo that exact answer. In addition, I'll also talk about employees. So one of our 3 campuses, we're repurposing so that employees working with COVID patients can house overnight so they don't have to go home to their families and expose them, and we open that up to all of our facilities to use.
Great.
I just one final one. You know, we've been talking a lot about staying home and trying to hunker down. That's for people who have a stationary home. And in the Permian Basin, there are a lot of transient and temporary people who live here in large facilities and RV parks spanning the region. As healthcare providers, what is your advice to them to stay safe during this time if someone is living at a man camp?
You know, one thing, just like they said with the students, some of these RV parks and man camps here are temporary homes, and then their regular home is off in Houston or wherever. I think if they're going to hunker down here, stay clean. Keep that place clean. Keep your hands clean. Keep your high touch points clean. Just like any other business and any other school, any place a lot of people touch or gather is a higher risk for this to be transmitted there. So be careful with that and make sure your high touch points are cleaned very frequently.
So the only thing I want to add to that is that the CDC website is probably the best source we have of how to stay protected when you are home. how to stay protected when you are in that kind of setting. I would answer your question with just the 6-foot distance. That's the best thing we can explain to these people. But the CDC website also has a lot more of how to clean different surfaces, how to wash different things, how to deal with utensils, things like that. So I encourage everybody to go to cdc.gov to get all the information they need on exactly what to do if you think you get sick, if you are sick, and how to prevent yourself from getting sick.
Thank you, guys. Appreciate it. Thank you.
I'm glad I'm an education doctor and not a medical doctor. Such great respect for the medical community. After just sitting there and listening to all of that, just thank you for all that's a lot of work happening. Gives me great confidence as a resident of this community just to listen to the experts share the story and words of wisdom. So happy to answer any questions that you all have. Absolutely. So tomorrow morning, starting Wednesday, 5 days a week, 7 a.m. to 9 p.m., available for any student, pre-K through 12th grade, or any parent that may be dealing with some of the stress that's happening in our current environment, any trauma situations. Just if anybody needs to speak with a counselor because they're struggling with our current reality, and they just need somebody to listen to them, talk with them, share their thoughts. Our counselors are going to be available for that, 7 a.m. to 9 p.m. Right now, over the phone, we'll explore other avenues, but right now these are just phone calls. That information will be available on our website.
Is there anything going on as far as discussion for credit, like to pass for the next grade and all that? Are you guys looking forward to planning putting something in place for that?
We are. So we are having conversations. In fact, every school district in Texas right now, and kind of leaning on the guidance from the Texas Education Agency to think about what transitions will look like. You know, assuming that we are potentially not going to return to school this particular year, how will we make decisions about students moving from the grade that they're in now and to the next grade? And same thing with our seniors. We want to make sure that our seniors graduate from high school. And so we're having those conversations. That's why it is so important that all of our kids are actively engaged in the remote school that we're offering now, because that body of work will impact those decisions that we will make in the future. Any other questions? Yes, sir.
You know, all your students don't have access to computers and the internet, and what is being done to give them access to that essential technology?
Yeah, so we actually, right now, remote learning happens in two ways. We have kind of the paper pencil version and the online version. Many of our families are actually using both right now, and that's really because of student preference. Some kids prefer to do some work using paper pencil and other work in a digital format. We are also making strides as a system. We recognize that we need to provide more digital tools and wireless access to our families. So there's a big body of work happening today in ECISD to secure devices for our kids, and we will begin a distribution process to make sure that as many kids as possible have access to the tools of technology. We're also working with our some providers to looking at expanding our LTE network, our wireless network, so that we can provide access to many of our students from their homes, and in fact some of our teachers too that don't have wireless access from home. We're working on those solutions as well.
Is there any concern that the paper resources for children who don't have internet may run out if so many people are using both digital and
We will not run out of paper resources. No, we're committed. A lot of the resources that our kids are using that are paper version were the same resources that they were using in school already. We're just transitioning those to home.
And what is the easiest way to make sure that you're caught up with what's going on?
Yeah. Easiest way to get information is to contact your teacher. You know, our teachers last Thursday and Friday attempted to make contact with every student in ECISD, all 34,000. And so today, you know, on Tuesday, if a student has not connected directly with their teacher, it's because we don't have your contact information. So moms and dads and families, if you have yet to hear from your school, please reach out. But staying in close communication with your child's teacher is the very best way to make sure you have the latest and greatest information. All right, thank you all very much.
questions?
You mentioned earlier about like an emergency management plan that you guys like have ready, but you know are yet to enact in case like things get more dire. Can you tell us a little bit about what's in that plan?
Well, let me tell you the first part of the plan. The emergency management plan has actually already been meeting. It is in partnership with the city. The first thing that we are going to do in the process of this was determining what players, what leaders the city had, what leaders the county had, hospitals, education, could come together, sit at the table, and be able to have conversations on what needs are, what our community needs are, but what also those individual taxing entity needs are as well. So there's an area called logistics, operations. There are 4 major departments that involve those units. We will start meeting tomorrow, 8 hours. We will be 8 hours doing that. Here at UTPB, they have given us a room that we will meet in, and we are going to begin that process so that we as a group can learn to communicate with each other, learn how to push down information to the media. We will be doing stat reports that will come from those leaders to a stat report through Devon that will be given out. And our goal is to do those every single day. That's what our goal is to be able to do that. I think and hope that by the end of this week, we will have achieved that goal, that those stat reports will be given to you. We also have a room here that we'll be able to actually do press releases in, so that if the stat reports are not giving you everything that you need, then we'll try to do that as well. But the last thing we want to do is not inform the media so that you can inform our communities. Yes.
You have game rooms in the county,
Mm-hmm.
and a lot of elderly go there. So what is the county doing to get information to those game rooms?
Okay, so the game rooms, and I got a lot of, myself and the sheriff got a lot of text messages and phone calls about the game rooms. As long as the game room, including their employees, have 10 people or less, they can remain open. It's when they violate that they can be shut down. And the sheriff, I cannot speak for the game rooms that are inside the city limits, but those that are in the county, if you violate that law, you will have your permit taken from you. And it will be at the discretion of the sheriff's department as to when that permit will be reissued to you. Yes.
Midland County is working to release nonviolent prisoners from their jail to reduce their population. Is there any kind of work being done in Ector County to do the same?
That would be the sheriff's question.
Is the sheriff here?
He's not.
Well, you don't have any insight as the judge in the county?
You would need to ask the sheriff. He's an elected official. You'll need to ask him what his procedures are. Any other questions? All righty. Thank you all very much for being here. We appreciate it.